Good afternoon, everyone, and welcome to the third of the 8 presentations in the SILGA Speaker Series. My name is Barbara Wiebe. I'm a councillor with the District of Lillooet, as well as a director on the SILGA board. I would like to acknowledge that we are producing this presentation while on the traditional unceded lands of the Tk'emlúps, Secwépemc people, and I apologize if I mispronounced that. I'd like to thank all of the sponsors that supported this speaker series: BC Assessment, Fortis BC, ICBC, Municipal Finance Authority, Southern Interior Development Initiative Trust, Shaw Communications, TELUS, and Trans Mountain Expansion. One housekeeping note before we get going with the presentation: when you want to ask the presenter a question, please use the chat feature to type in your question, including your name and your community in your post. As host, I will read out the question, including who it is from, to the panel. Get your questions in early. I would like to introduce our sponsor for this session, Ingrid Brackop, Road Safety and Community Coordinator with ICBC.
Hi, I'm Ingrid Brackop, and I work in road safety at ICBC. On May 1st, there are going to be some exciting changes happening to ICBC auto insurance. We call it Enhanced Care. And Enhanced Care will mean more affordable car insurance for British Columbians, with an average savings of 20% for customers with full ICBC basic and optional insurance coverage. Enhanced Care will also mean significantly more medical care and recovery benefits for any BC resident who is injured in a crash. Current limits of $300,000 will be replaced with a no overall limit for medical rehabilitation benefits. Enhanced Care will offer you access to all the care that you need when you need it for as long as you need it, whether you're responsible for the collision or not. Fault still matters. Drivers who cause crashes and those who drive dangerously will still be accountable and pay more for their insurance. But no one plans to be in a car crash, so even if you've caused a crash, your health is important and you deserve access to all of the care that you need to recover. Enhanced Care will offer much better recovery benefits and income replacement, enhancing care, so there will be no need to consider taking legal action after a crash to get the care and financial support you feel that you need. Enhanced Care will automatically take effect for everyone on May 1st. Following that, British Columbians can expect to receive a one-time pro-rated Enhanced Care refund in addition to the savings they receive at renewal time. These savings from Enhanced Care are in addition to the rebate that we are issuing due to the impact of COVID-19 on ICBC's finances. At ICBC, we are committed to a better way forward for all British Columbians. And to learn more about Enhanced Care, please visit icbc.com. And when it's time to renew your insurance, ICBC's province-wide network of auto plan brokers can help you to answer the questions that you have about Enhanced Care and provide advice on what coverages are right for you. British Columbians deserve an auto insurance that is affordable and offers the care we need when we need it, and this is exactly what Enhanced Care will deliver. Dr. de Villiers completed his medical and specialty training in South Africa, and as a public health and preventative medicine specialist, he has spent the past 20 years working in Northern Canada. After 3 years in Thompson, Manitoba, he moved to the role of Zone Lead Medical Officer of Health for Alberta Health Services. Dr. de Villiers was also the Lead Medical Officer of Health for Emergency Disaster Management for AHS and served as President of the Alberta Medical Association section of Public Health and Preventative Medicine. Dr. de Villiers has been in his current role with Interior Health since August 2020. Please welcome Dr. Albert de Villiers.
Thank you. I'll start just by introducing myself and then my co-partner in crime, Carl Meadows, who's the Executive Director in the Southern Okanagan, and he's going to be here to help me answer some of the more difficult questions. I'll switch to sharing my screen. So like I said, I'm Dr. Albert Villiers. I'm the Chief Medical Health Officer here in Interior Health since August. And Carl Meadows joined me as well. He's the Clinical Operations Executive Director in the Southern Okanagan. So he'll be here to answer some of your more difficult questions. I asked him to do the difficult ones. I'll try to do the easy ones. So, I mean, the acknowledgement's already been done, but I just want to add one little piece as well. Also, we've also got a partnership with the BC Nation, the Mighty Nation of BC as well, and also with the Mighty citizens residing within our health authority as well, and then all the First Nations territories that we thoroughly enjoy and are really thankful that we can be on their land to help fight this pandemic. So I thought I'll just start with some very high level numbers. On the left-hand side, the blue, that's the provincial numbers basically since last, I think it starts in February. And then on the right-hand side is specifically for interior health. So the important thing to see is you can see around December, we had a little bit of a blip going up. It went down again, and then it went up again in the middle of January. We have come down dramatically, but we've stabilized. It's not down to the numbers before we had in October, November last year, but the numbers have definitely stabilized. You can see province-wide as well, there was a little bit of increase in February. In March, they're starting to be a stabilization as well. Just a little bit more detail with our region. I know this is a very small little slide, but you can get all this on, I put the link at the bottom as well on the BC CDC website. And if you look at, we are there currently, Okanagan, you can see we had a little bit of a blip. This was last year, July, if you can remember that. And then it went up and it's coming down in the Okanagan specifically. This is our other one, East Kootenay. That's not too bad. It got a little bit of a blip there as well. Remember, there was some issues in Fernie, and then Kootenay boundary has been relatively stable. Thompson, Caribou, Sushop had an issue. There was an outbreak there at the Royal Inland Hospital, so there was a little bit of an issue there. But in the central Okanagan, it has slowly come down over the last few months. But this is all publicly available information if you want to go look into the details behind this. So overall, looking at the numbers, we remain cautiously optimistic about the trends we're seeing and the COVID transmission throughout the interior. However, as we have seen with the outbreak that started recently in one of the long-term cares here in Kelowna, that this is no time to let our guard down. There's COVID all over interior health, all over the Southern Okanagan, and we need to make sure we are still vigilant and we keep it out of our schools and we keep it out of our workplaces because we are still seeing cases. I'll just say one or two short sentence about the variants, and the main reason I'm saying something is because it is out in the media, and we have seen some of the variants of concern in interior health as well in our area. What I want to say about it is that at this stage, we are not doing a lot different. We're doing a little bit of extra follow-up, a little bit of extra testing, but they are predicting that within a few months, the different variants from the UK will probably take over the current variant. And that's just the way a virus goes. So it's nothing to be alarmed about. We haven't seen that they actually increase hospitalization, these variants, or more severe disease. Actually, what it does show is, if you think there is, let me put it into perspective. Usually, if a person gets sick and he can infect somebody else, it increases a tiny little bit with a variant. So it's the difference between 2 in 1,000 and 3 in 1,000. So if there's 1,000 people exposed, 2 will get it with a regular one, 3 might get it with a variant. So it's a very small difference. That's what we're seeing at this point. So we are not too worried about them. Yes, they are concerning because we want to make sure we keep close eye on them and keep close track of them, especially initially. But as I said, it'll probably become the most variant. I mean, the variant will become the overwhelming one in BC specifically, and then it'll just be as it is normally. We're not doing anything different in that sense. You don't have to isolate longer, or you don't have to get special treatment for it. So I'm just going to leave that one there, because I know there has been some questions and people are worried about it. As far as outbreaks go, we do have an outbreak currently in Kelowna General Hospital. It's a relatively small one. But then also there is also an outbreak that was just announced a few days ago in Cottonwoods in Kelowna. And I mean, I've got lots of information on that, but I can maybe leave that for questions if there's anybody that's specifically interested in that. I'll maybe just say at this stage, that outbreak does not show that the vaccine does not work. The vaccine is still working. Actually, most of the people that got infected at that facility were people in the short stay unit. So there's the short stay and then there's the long-term care. Overwhelming majority of the cases has been in the short stay side, and they were not in long-term care before to be able to get vaccine. So most of them have not had vaccine. And those who have had vaccine in general get milder disease. And just to clarify that piece as well, that we know that vaccine does not prevent spread of disease. We know what the vaccine does. It prevents the disease from being more serious, and it prevents hospitalization, and it prevents deaths. So that's what we're looking forward with this one specifically, because I mean, being from the southern Okanagan, you'll know we had this outbreak in McKinney Place in Oliver, a really sad outbreak. And there, I think we got to about 80–90% of the actual residents became sick. Lots of them were hospitalized. Quite a few passed away, unfortunately. This was before we had vaccine. So we are really looking forward, not looking forward to outbreaks, but looking forward to the outbreaks being more manageable in the future due to the vaccine. So people might still get disease, but it won't be as serious. A little bit about the vaccine plan. As you're probably aware, it was announced last week that we are in phase 2 now of the immunization, the BC immunization plan. So just very broadly speaking, that means that about 400,000 people in BC will be immunized from now until the middle of April. And the focus is still to make sure we protect all our seniors and the vulnerable. So to date, we've really seen remarkable progress. We've started late December, end of December in Interior Health to give vaccine, and we are over 50,000 doses is on the last count. It changes a lot because we average, I think, close to 1,500 to 2,000 a day, depending on the day. We are pushing that number up. So that number changes daily. But there is a lot of work going into this, and a lot of people are working tirelessly. And as we move ahead and provide immunization to more and more people, more of the vulnerable people will be able to be protected. And as Dr. Henry said before as well, hopefully then we'll be able to start slowing down on some of the measures and some of the orders, so we can have a little bit more freedom. So as of March 8th, which was Monday, eligible seniors can call the dedicated phone line. And I know Monday there was a little bit of a glitch, not a glitch, people just called so many people. But now, as of today, I spoke to the people this morning at the call center. If you call, the phone will be immediately answered within seconds. Basically, it takes just that time to put you through to the right person. But there's no wait time at this stage. So we've actually asked people for next week, if as the next group becomes eligible, maybe wait until Tuesday or Wednesday. Not everybody has to call on Monday, because then you are going to wait a little bit longer. But if you can wait a few days, then you can still make your call. So as I said, this week we started seniors aged 90 and older, and Aboriginal people aged 65 and over, and also Aboriginal people who identify as seniors. And I know some of the communities brings that down to the age of 55, that you are deemed as an elder in your community. So those are all included at this point as well. Next Monday, the seniors aged 85 and older will be able to call in. The Monday after, seniors age 80 and older will be able to call in. And there's a lot of caveats and a lot of things behind this. So if you've got a spouse that's not yet 80, they can still call in. So this is not all the detail. All the detail is on the Immunize BC website. This is just the broad highlights. And on an ongoing basis, we are also doing our seniors and staff in independent living, also home support clients and staff, and also other vulnerable populations in congregate settings, like some of the group homes. We've also gone into some of the homeless shelters to make sure that they're all covered as well. And we also continue to vaccinate our healthcare workers in our clinical settings, and also expanding to community healthcare workers, including the general practitioners and the specialists and all the medical office staff as well. So I think I'll leave it there for COVID, and then switch to our other public health emergency that's currently going on, the other side of the coin, it seems like. We have seen, and this is from the BC Coroner's report from February, it was the latest one that came out in end of February. And as you can see, I'll talk a little bit about it, but just kind of let this picture sink in. So this starts in 1994 on the left-hand side, and there was a little blip in 98, and it kind of stabilized, went down, and in 2015-16, it really started picking up, unfortunately. 2019, as you can see, it went a little bit better, but then COVID hit, and it's not going in the right direction currently. So the last 5 years, I mean, this April will mark actually the 5th anniversary since the overdose was declared a public health emergency. And in those 5 years, there's been tremendous amount accomplished. There's increased surveillance, there's better data gathering, there's enhanced mental health and substance use services, there's increased access to opioid agonist treatment, or they call it OAT, and recent also the IAOT and TIOT. There's a lot of different programs basically to help the people. And the first interior health cohort of nurse practitioners for Suboxone has just completed their training. So basically now the nurse practitioners can do prescribing as well, which is great. At the same time, there's planning underway to further the use of safe pharmaceutical alternatives by expanding the types of medication that can be prescribed and dispensed in BC as well. There's also been introduction of overdose prevention services and supervised consumption services, with episodic overdose prevention services currently being planned for more remote communities. Currently, they're working in Cranbrook to get it implemented there. And also the whole thing about the take-home naloxone. I know that some people are moving away from that name, just FYI, because if you are homeless, you can't really take your naloxone kit home. So they tend to call it community-based naloxone kits now, and not take home, because if you don't have a home, there's nowhere to go. So like I said, in 2019, the data showed efforts were turning the tide on the opioid crisis. And we were cautiously optimistic at that point. But then I said, as COVID struck, we found ourselves in the midst of this dual public health emergencies, and some of the effort, unfortunately, had to go to COVID, because that was the one in our face, and some of the resources were not necessarily where they could have been or should have been, because we all know there's only so much one person can do. We are starting to shift back, trying to get the focus back on the opioid crisis as well, because, I mean, according to the latest coroner's report, more than 5 people are dying every day in BC due to an illicit drug overdose. In 2020, we've had our highest number of deaths in a year, 283 in interior health, and like I said, it's the highest ever, and it's not good news. Overdoses have also become increasingly complex, as the street drug supply is already tainted with high toxic opioid analogs such as fentanyl. They keep on changing. It's kind of like this virus, I feel, because we keep on getting the variants and different things, but this is the same. It keeps on changing, and they keep on adjusting it. So in addition to fentanyl, which shows up in over 90% of our samples tested, many drug samples are now being found to have other contaminants like benzodiazepines and some other tranquilizers, and that can cause unconsciousness and drowsiness and eventually death as well with an overdose of that. So the presence of these benzodiazepines and the benzodiazepines that are made and sold illegally mixed with other substances rapidly increased from 15% in July to about 49% in January now of 2021. So it is rapidly increased, and that is a very alarming trend as well. This is concerning because they're kind of tranquilizers and they don't respond to naloxone as well as fentanyl does on its own, because naloxone is what we usually give, as people might know, if there's an opioid overdose or no. But now, because because that can stop people from breathing, it kind of slows down their breathing. But with this tranquilizer, it doesn't. The naloxone doesn't work as well anymore. So the overdose is getting more and more complicated and complex to manage as well. As always, stigma plays a role in overdose crisis. And because of that, because people don't want to necessarily come out and say that they do have an issue and they are using drugs, the majority of people who die of overdose still die alone, which is really sad. 70% of those dying were 30 to 59-year-olds. So that's people in the prime of their life, that is productive in society. And males account for 83% of deaths. And about more than 55% occurred in private residences. So it's not, sometimes people have this picture, oh, it's homeless people living under a bridge or something, but it's not. More than half is actually in a private residence, in the basement, or somewhere where people still use drugs and pass away due to that. So what has been the impact on COVID-19 on the overdose crisis as well? While we cannot say for sure how COVID-19 is impacting overdose rates, there are some things that you can think, I mean, just logically, because border closures may have impacted the illicit drug supply. So people use different drugs now from unfamiliar sources. I know it sounds like a weird thing to say, but people were used to a certain kind of drug that they got because they could get it across the border, and now they can't anymore. So now they've got to go to different sources and people making drugs in their basements, which isn't as reliable. They may also be using frequently alone, more frequent than before, due to the self-isolation or social distancing and the physical distancing that we've been advocating to help COVID. This pushed some people that might have been socially distant anyway, even further underground. One other thing that we've heard as well is people may not be calling an ambulance or going to the hospital to report overdoses because they're afraid of getting COVID-19. We heard it specifically when some of our hospitals have got COVID outbreaks, people don't want to go and they don't want to call the ambulance because they don't want to see somebody else with COVID. And then unfortunately they get side effects from the opioids. So COVID-19 is also a virus that can cause respiratory infection and other health problems. And fentanyl and some of the other opioids can slow a person's breathing. So if you've got COVID and on top of that take too much fentanyl, that might also be an increased risk for overdose death due to opioids because your lungs are already affected. So all these factors put people who use drugs at a greater risk. And we encourage people who are using or considering using, if you know somebody, or to please consider to take steps to prevent overdose and to make sure we can actually decrease some of the overdose numbers here in interior health. So most harm reduction and overdose prevention services are operating currently. It includes our regular drug checking services and our supervised consumption services. But like other healthcare settings, in some cases, the services may look a little bit different due to COVID restrictions. For example, the hours might be a little bit different. So it's good for people to call ahead and make sure that the hours are still the same. I know initially there were some issues around group therapy because I know people with some mental health issues really benefit from that, and that has been solved. I know initially it was an issue that we couldn't do that. But some people might not be aware of that yet. So that definitely had an impact as well on the overdose crisis. So what are the other things we are doing to make sure we can respond to this crisis? So in BC in 2020, in September, it was announced that in addition to physicians and nurse practitioners, now nurses, who's registered nurses and registered psychiatric nurses with special training will also be able to prescribe medications under the Controlled Substance Act for people with opioid use disorder, and that really increased the scope of what we can do for people. Within Interior Health, we've got nurses like that. I said they've been trained and they will be located in Penticton, Vernon, Cranbrook, Nelson. There's the whole list. You can see it there. I think the ones in your area is basically Penticton, and there's some working around Kelowna as well. So at the same time, there's planning underway to further the use of other safer pharmaceutical alternatives by expanding the type of medication that can be prescribed and dispensed in BC. And this is important life-saving work, supported provincially by the BC Centre for Substance Abuse. And the Ministry of Mental Health and Addiction is also monitoring and evaluating the data to make sure that the health outcomes are actually good and that it's actually effective and that we can actually get ahead of this. Then there's what we call episodic overdose prevention services. That involves the development of it's a new protocol for healthcare staff in selected locations to safely support people who require overdose prevention services, including the consumption of drugs in a private and hygienic setting. Because I know some people are like, oh, we should just stop these people from using drugs, but that's not feasible. That's what we call harm reduction. We know people are going to do harmful things, like driving. We know people are going to drive. How do we make it safer? We put airbags in and we put seatbelts in. So this is kind of at that same level, I think. We need to make sure if people are going to use drugs, let them use it in a private place where they don't have to be pointed out and actually clean as well. And also monitoring and responding in the case of overdoses, providing harm reduction, such as, like I said, to take home naloxone kits, and facilitating connections and referrals to other health and mental health services. So if you connect in with one of these services, they can refer you. If you need a social worker or you need some mental health support, people will be able to connect each other. So Interior Health has been conducting training and engagement around this new protocol. And in the coming weeks and months, we'll be implementing in several sites. There's some in Lillooet, further up north, 100 Mile House, Penticton Regional Hospital as well, Cranbrook and Sparwood as well. So while we're not establishing permanent overdose prevention services in these facilities, this is an important step to help staff respond to urgent overdose prevention needs in some locations that have seen increases in overdoses and overdose deaths, unfortunately. We know that these are life-saving services, and research shows that the combined response are providing access to take-home naloxone and the opioid agonist treatment such as methadone or Suboxone that you might have heard of, and the safe consumption sites have been effective in averting many overdose deaths in BC. So we know the situation looks grim, but if it wasn't for these services, it would have been much worse. So sorry, I didn't end on a positive note, because this is not a positive story at this stage. We are still working at getting there. So I'll stop here and I'll leave it open for questions and discussion.
Thank you so much, Dr. de Villiers and Carl Meadows, for that very informative presentation. We now move into question and answer portion of this session. Please use the chat feature on your Zoom feed to ask Dr. de Villiers a question, and remember to include your name and your community. Okay, I have a couple here already. Louise Wallace-Richmond from Salmon Arm. Dr. de Villiers would like to acknowledge that it's been a challenging time on the IH front, and given IH's extensive population health scope and large geographic area, how can municipalities and regional districts best work with IH to meet our mutual goals for healthy communities?
I'll start, and Carl, maybe you can throw in from your perspective as well. I know at most of the local areas, we do have groups that are working together. We've got some local committees that are specifically looking at healthy communities. There's a whole team that report up to me that is called Healthy Communities. So you can reach out to them. If you can't find them, reach out to me and I can put you in contact with them. And that is trying to be really comprehensive. So it includes some of this harm reduction work. There's a lot of other work that, unfortunately, due to COVID and the opioid emergency as well, has been left behind a little bit. There's healthy community development. There's other kind of walkable spaces, making sure people can get out and get active. There's a whole bunch of work that we are starting to pick up now that COVID is slowing down a little bit and we got the vaccine, that we can work again. But definitely we do have groups in most communities, and sometimes it's a group of communities together that work together to address some of these issues. But definitely I think it's something that we need to address in the future and need to address more, because at the end of the day, if people are healthy in your community, they're going to be happier and they're going to be more productive.
I think working with municipalities, and in my role as executive director for South Okanagan Clinical Operations, which includes everything, I think, working with our local officials, really, there's actually an anti-stigma toolkit. Stigma and stereotypes within elected officials is a really important area to consider around how municipalities are messaging things through not only councils and various other things, but it really makes an impact if we work closely with our mayors and our councillors, and we meet with them frequently. And it's really, really important to make sure that we actually understand the issues together. And so one of the biggest challenge is stigma and stereotyping. And quite often we are dealing with stigma and stereotyping and not actually working towards root cause issues. So some of the things that I see and we hear is that, assigning housing with drug addicts, or low barrier housing, or social housing with crime. And there's just things that you can hear. And then things like homelessness and addiction, and just those things, we have to work together on them. And quite often when we tell our municipal leaders, actually paint the picture that Albert just did so beautifully, the people that are dying are from every socioeconomic class, every race, and some of these stereotypes that the homeless people are, and this is just, I'm generalizing, but that these are the criminals and they're living in the creeks and we've got to watch them in this air of suspicion. They're not the one that are dying. They're just trying to survive, with a meal or making sure they're kept warm. So I think that's one of the areas that, if I was to answer the question, that's an area that we have to work really hard on. So we work with our CMP superintendent, our mayor, and when we meet, we actually make sure we're all on the same page around the messaging. And I think that's a really good starting point.
Thank you. The next question is from Spencer Coyne in Princeton. Opioid overdoses are still a major concern across the province, and especially within the SILGA region. Why have mental health and addiction supports been scaled back instead of being increased? Princeton saw the closure of the adult drop-in center at the very beginning of the pandemic, and now they are seeing Pathways funding removed. Although we would all agree consistency in development is important, major interruptions in service can have major implications when dealing with addictions and mental health. How will IHA ensure that these clients and future clients will see a consistent service delivery that will be there to support them?
Thank you for that, and thank you, Spencer. I'll jump in on this one. So some of the challenges with contracts, with our contracted services. So I think, Spencer, the case you're referring to is the nonprofit, the Clubhouse out in Princeton. That was not the Interior Health want. They actually couldn't satisfy their contractual agreement, and they actually came forward and to give us notice that we actually they couldn't provide the service anymore. So that's what happened with the clubhouse. But we went through every client during that transition to make sure that they were aligned with one or whatever services they need. So we looked at every individual client when we transitioned them back through the community. In fact, so Interior Health is shifting substance use counseling services in the Okanagan, South Okanagan, from an external contract to internally operated services. That will start June 1st. So we have actually, funding has been redirected in many areas to actually bolster our internal services. So mental health services, as an example, has increased significantly with funding support from the Ministry of Health. So we've actually seen growth in this area, and that's validated by yesterday's ministers and our CEO's announcement around the Urgent Primary Care Center opening up in Penticton and focusing during the day on that. We call it longitudinal, but it's the mental health client. And we are actually using our old area to actually repatriate clinical services. Again, we are seeing growth in this area, and we're seeing increased ministry funding in this area. And Spencer, the Princeton area is absolutely on our mind. And in fact, the reason we are repatriating these services is to make sure that all of the South Okanagan has access to counseling services, substance use counseling services, and then making sure it's integrated with all of our other team-based care, including primary care in Princeton, or in our area, it would be Ponderosa Clinic, the Martin Street Clinic, and other physician clinics. So we are moving in that direction to make sure that we actually understand what customers need, what their needs are, and meeting them where they're at. So I actually see that this is a very positive move for the South Okanagan.
Dr. de Villiers, do you have anything to add to that?
I'll maybe just add as well that we do have a team of medical health officers that report up to me, and we've got one dedicated to the opioid crisis now. She was Dr. Goodison. She was pulled into COVID a little bit, but we have already released her again to make sure she focuses on the opioid crisis. So we're definitely trying to increase the staffing there as well, because we know it's a huge issue that needs to be addressed.
Okay, our next question is from a fellow councillor, Jamie Howe in Lillooet. Where would we find studies showing effectiveness of current and previous efforts to reduce deaths from the opioid crisis?
Yeah, Carl, I can start if you want to add something. We can share some information. I mean, if you go to on the BCCDC website, there's some information as well. And there's some really good research as to what should be done. And those are all the things we are trying to do to really try to get to the people, use their own peers, use to take home naloxone, and make sure the services are there, make sure we get rid of the stigma. So there's varied forms of research and a lot of research out there. We can share through the organizer, we can share some links to some of those.
No, I would just add to that we can also share, Albert, we could share the anti-stigma toolkit, because it is one of the most important things. And we're actually, for us in the South Okanagan, working with Brian Hunter, our RCMP superintendent, and also the city. And we're actually got the toolkit now, and we're all doing an evaluation of our organizations and just looking and reviewing how we are perpetuating images of various groups and whether we actually would pass the test on stigma. So I think that's really important. And Albert, I think we could share that absolutely with Mike and the team.
Thank you. From Mayor Ken Christian in Kamloops. First, thanks for appointing Dr. Fenton to Kamloops. She's a great asset to our public health community. Second, can you influence mental health to provide more CAR 40 services in Kamloops?
Thanks for the question, Ken. Yeah, and I think Carol's been around. Dr. Fenton has been around for about a year now, and she's really enjoying working in Kamloops as well. So it is great to have her. Around the influencing, I'm not. I talk frequently to the mental health and addiction group as well, and I know they do have some plans in place, and we'll have to get back to you about the details. As with any program, we always try to look at, is this program a useful program? What does the data show? What does the research show? And then we can adjust accordingly. So if it's a good program and we know it actually works, then we can expand it. If it's not as good, then we can change and make sure we put another program in place, because we do want to get to these people, definitely. And Carl, I see you want to add something.
Yeah, it's if I understand the question, that the program is having mental health professionals with physicians, so for mental health crisis in the community. So there's various models out there. I'm not the RCMP, and it was a model that was actually, I believe, in the Lower Mainland that started, so I might have that wrong. But we work, for example, with our RCMP, and just going with what Albert said, it's really about working together, regardless of what program you have. So we work very closely with our CMP liaisons out of our merge department. And now we actually got a meeting set where we're meeting Brian Hunter and his team to actually talk about the new Urgent Primary Community Care Center and how that will have to rejig how we actually do work now with the RCMP. Lots of conversations about wellness checks, and RCMP and us have really had really great conversations around whose lane are you in. And we agree here in South Okanagan that the police have a very important role to play, but if it's a health or a wellness check, that's healthcare, and we need to be working together. So absolutely joint visits. You don't need a special program to actually work with the RCMP to make sure that on wellness checks, the healthcare lead is actually front and center on it. And then just for staff safety, the RCMP may be in the background. But those are things that you don't need a program for. So it really goes, and not to say that those that have it and have funded model that it's not working, and it probably is, but I think every community working in collaboration with their municipal leaders and their law enforcement come up with incredible innovations without cut and pasting what's happening somewhere else.
Thank you. I have an anonymous question, but I think it's probably on a lot of people's minds. Will BC be considering using convalescent plasma for COVID-19 therapies as is happening in Germany?
I'm not sure whether either of us are able to answer that. I don't really work with a treatment specifically of COVID cases, so that's probably a question for one of the infectious disease specialists. So no, I'm not aware of any of that, and I'm not aware where we're going with that. So sorry.
That's fine. Do we have any more questions coming through? If not, I'd like to thank everyone for all your questions. And thanks again to Dr. de Villiers and Carl Meadows for being with us today. I believe this is one of our better attended speaker series, and I'm not sure if it's the personalities or the topic, but let's go with the personalities.
It's probably the overwhelming beauty of me and Albert. I'm just saying.
What does that say about me? I've enjoyed this presentation, and I've really enjoyed stepping out of my comfort zone and doing this afternoon. Maybe my future life when I grow up will be a radio talk show host. I'd also like to thank Mike and Bonnie from Lee's Music for providing the AV services for the series. For those that are registered, you will be able to watch the recording again on the Lee's Music YouTube channel. Each Monday, SILGA will send out an email with the link to the uploaded video, as well as information on the upcoming session. This email will come directly from Civic Information, so check your spam if you haven't received an email. I'd like to remind you that next Wednesday at noon, so we're moving forward, plus the clocks are springing forward on Saturday, so that should be really confusing, but it's at noon. We will have Dr. Will Garrett-Petts from Thompson Rivers University, who was speaking on community-engaged research in the time of COVID-19 and why we need to think beyond a project focus. And I really hope to meet everyone a whole year on SILGA, and I finally got to meet Allison. I'm really hoping to meet several others next year at convention in person, and we'll see you next Wednesday. Enjoy the rest of your day.